started your timer, and here is your question. Right. So if you have read and understood, considering a critical care scenario, kindly please tell me, how would you manage this patient now?
I will manage the patient according to ATLS protocol. I will go
Good.
for ABCD approach
Yes.
with simultaneous resuscitation as well.
Yes.
And for I will go for I will go to
Yes.
check airway patent or not. I will talk to the patient if patient can speak or not. If patient can speak, I will assume that airway is patent,
Yes.
and I will also check for any foreign body in her mouth and evacuate that. And after ensuring the airway is patent, I will go for immobilization of cervical spine,
Very
and
good.
for then I will jump for to check the breathing. As patient has difficulty in breathing,
Yes.
I will check if there is any chest trauma or present. There may be any inadequate respiration. Will count the respiratory rate, and I will check the chest movement during respiration. And I will look for, I will palpate and auscultate for any signs of hemothorax or pneumothorax
Good.
present or not. And then
In that
side by
case,
side,
yes.
I will give oxygen, high
Very
flow
good.
oxygen to the patient, 15 liter per minute, and
Good.
I will continue pulse oximeter assessment, and then for circulation, I will check if there is any external bleeding, as patient has open fracture tibia, tibia fibula. I will stop that external bleeding. But I can stop that by elevation of his right lower limb,
Yes.
as well as put a pressure bandage.
Yes.
And after that, I will side by side, I will open to whiteboard channel and send blood samples for blood sampling and complete blood count and basic investigations. And I will start the resuscitation fluid. I will go for blood transfusion as well if needed. And as there is a chance of pelvic fracture, as I will give a
Yes.
pelvic binder
Yes.
just from the beginning. It should be in the pre-hospital setup if possible. And
Okay.
I will, yes, ma'am.
Yes.
I will
Yes.
give tranexamic acid injection as soon as possible.
Okay.
And after the primary survey, as
Yes.
well as I will continue the ABCD, I will complete the ABCD E approach and do the necessary investigations like serial X-ray involving neck, chest, and pelvis, cervical spine, chest, and pelvis. And
Just
if uh,
yes. Just suppose you've done this X-ray. Can you tell me what you see, or how would you read this image?
this is a chest X-ray AP view showing
Yes.
trachea shifted towards the left side,
Okay.
and hypertranslucency involving the right lung field with collapsed lung
Yes.
margin.
Yes. And
And there is also a radio opaque shadow involving left lung field.
yes. And
along with uh, mm, uh,
how would you comment on
uh,
the cardiac shadow, or what you see?
cardiac shadow is enlarged as
Yes,
well, and left cardiophrenic and left costophrenic angle is not clear.
not clear. What about on the right side? This arrow is pointing at what?
This is the collapsed right lung
Right
margin.
lung. Okay, in that scenario, maybe the patient is undergoing pneumothorax. How should this patient be managed?
Patient should be managed according to HLS protocol, and for the breathing,
Yes.
I will confirm that patient is having right pneumothorax, right-sided pneumothorax, as well as patient may have left-sided pneumothorax as well. And I will give high flow oxygen, 15
And
liter per minute, and do immediate needle thoracostomy in
yes,
the left, in the right fourth or fifth intercostal space, just enter to the mid axillary line. And subsequently, I will put a chest drain tube.
considering the injuries or the fractures this patient has acquired, how would you class the level of shock or hemorrhagic shock of this patient?
Patient may be in a class 4 hemorrhagic shock.
Yes, how? Please explain.
Patient has tibiofibular fracture, that there
Yes,
will be massive bleeding,
yes,
and
and
patient is unconscious as well, and patient also has pelvic fracture,
yes,
so there will be major bleeding,
yes.
and patient's
How
vitals
much
are
should be
unstable.
the blood loss that you should expect when patient is undergoing class 4 hemorrhagic shock?
Class 4 hemorrhagic shock, there will be more than 40%
Okay,
uh,
more than
of
2
the
liters.
total blood volume.
Yes. How would that affect urinary output of the patient?
Uh, it will be, it may be less than 5 ml per
Yes,
hour.
or even in uric. How that
Yes,
does that affect the patient's mental status
mental status, if patient may be unconscious
or lethargic?
or
Okay.
disoriented.
Yes. How should the patient be managed? How would you manage the hemorrhagic shock? Simply.
I will manage the patient first by resuscitation with crystallite fluid.
Yes.
I will give the bolus fluid with 1 liter, most likely Hartmann
Then
solution.
SXS, 2 large bore cannula, then all this. Okay. Yes.
Yes, ma'am.
You'll cross match the blood as well, or
Cross
you'll give
match the
the,
blood, and
okay.
subsequently I will give blood transfusion.
Yes.
And simultaneously I will search, I will look for the source of bleeding, ongoing bleeding, if patient is hemodynamically unstable, and put a pelvic binder if there is any pelvic fracture
Yes.
suspected.
Patient is also
And
has presented with abdominal abrasions.
yes, ma'am, there
What
may
do you
be a renal
suggest?
injury as
Yes, or maybe liver trauma,
yes, ma'am.
because it's not specified. Okay,
Okay, yes, ma'am.
how should you manage if you suspect liver trauma
If I suspect liver trauma,
or
I will go
laceration?
for
Yes,
conservative if patient is hemodynamically stable. But
yes,
if and do the first
can, okay,
ultrasound.
yes,
And if over the subsequent hours, if patient goes hemodynamic status goes unstable,
yes,
then I will decide for a damage control surgery.
surgical exploration. Okay, good. Can you please tell me how would you monitor or observe the response of the patient? Because in stage 4, we expect patient to be unconscious or lethargic. So how would you monitor the response of the patient over time?
I will monitor clinically by
Yes,
patient's pulse, blood pressure, urine output, capillary
yes,
blood flow,
yes,
and mental status.
yes. Blood pressure as well, heart rate, pulse. Okay, good. Right. One more question that I can ask you. Right. Just suppose you're waiting for blood transfusion to be arrived after doing the cross-matching and everything. Is there possible to give any blood products while you're waiting for your blood transfusion to be arrived?
blood
It's-
product, I can
it's
give
so,
factory
yes.
blood cell.
What would be your choice of blood product to give and why?
I can give
Can you give cryoprecipitate?
fresh frozen plasma.
Okay, fresh frozen plasma, that is also good blood product. And can you give cryoprecipitate? If yes, then why?
Cryoprecipitate. Yes, ma'am. I can also give cryoprecipitate.
Can you explain why?
As there is no RBC and there is no antigen present on the RBC
Okay.
in the donor blood,
Yes.
that will not react with the recipient's
Yes. So
antibody.
it's safe. It may not cause hypersensitivity reaction, and maybe
Yes, ma'am.
it
There is
can
no
be arranged
WBC as
quickly.
well. It will not cause
Yes. Good.
hypersensitivity.
Good. Thank you. Excellent.